Okay, this is the new Medline container for C-sections. We can tell that this container has been sterilized because this is black, these lines, and this thermal lock is down. That's on both sides. This thermal lock is red and it's in the down position. This tray, or this big container, can get anything spilled on it, it's still sterile. The only reason we would need to re-sterilize it is if it dropped on the ground.
Okay, as soon as you guys know there's going to be a stat C-section, these are the items you need to come in and double check are ready to go and have available. The first thing you're going to pull is your physician's box from the shelf. In the box, it contains, number one, a scalpel. It contains the doctor's gloves, and it also contains their suture. This all can be opened onto the sterile field once it is opened. The next thing you'll look at is your cautery. The on and off switch is on the left-hand side. Once it is turned on, it automatically defaults to the appropriate settings. The cautery pads, there should be one lying right on top of the cautery machine. If there is not one available, they are in the bin right underneath. Just peel it open. This part goes into the part where the pad is, and just push it in. The next part goes to your patient and needs to be applied to their upper thigh. After you get in the room, you need to ensure that there is a Neptune ready and available. It needs to be plugged in. On the front, there is 2 holes, here and here. One of the holes needs to have a filter. If there is not a filter in here, they are located on the back of the machine. Grab one of the filters. It has 2 prongs on it, one on each side. Line up the prongs with the openings on the front of the machine, and then twist. After, if this message appears, hit the OK button, turn both of your knobs so that the circle is in the orange, and then hit start. You should have a C-section pack on your back table ready to go. And you should also have an instrument pan on your Mayo stand ready to go.
Okay, there we go. You're fine.
Your prep will be located either on top of the cautery or on the table over here. To prep, open your prep from the top. Be sure not to touch the sponge side. Smack it, you gotta smack it kind of hard. It takes a minute, you will see the brown start to come into the white part. Once you see that appear, you can go ahead and begin to prep your patient. To prep, you will start at the incision line across and work your way up to about the epigastric area. After you are prepped up to there, come down to the legs, work from out to in to the vaginal area, all the way down to about mid-thigh.
Okay, this is for opening the room for a stat C-section. When you enter the room for opening, you have to have your hat on and your mask applied to open sterile supplies. The first place you will come is to the back table to open your pack.
This is just a demonstration of opening. We would actually open the pack that was on the table before.
Right, and we'll go over that in the demos. So now your back table is sterile. The second thing you're going to open is your instrument tray. So you'll come over here, open away from you, the two sides, and then towards you. Now you have a sterile field here that you don't want to touch. And the next thing you're going to do is get your bucket. We have Dr. Hakey's for this one. So the first thing to open would be your knife blade. You can open that on your sterile field.
And why is that important first thing, Michelle?
Because the physician will need that first in order to start the process of getting the baby out. Also, their gloves, they'll need that first. Put that on there. And the last thing that you need is suture.
I'm going to flash that camera the suture. Okay.
So just peel it from the top, flip it on the field. Okay? That'll
Can you do a timeout on this patient, please?
This is patient Jane Doe. She is a primary C-section for non-reassuring fetal heart tones. No beta blockers, no anticoagulants. Prep is dry and will have no fires.
Thank you. Tie the gal in the back as a non-sterile person, just the Velcro and tie here. She'll put her gloves on.
Someone push that nail up for me, please. Can someone hook suction and cautery up?
As a non-sterile person, make sure you grab the mayo or the table from down below the sterile field.
Okay, my suction and cautery is hooked up.
Yes.
How's everything's good? Okay. Cut.
Put that in here.
And we're gonna work off of here for that C-section. Okay. I'm out. My scrub, my CST got here. She's finishing up the case, so she's going to lift this up off of the tray. Do everything with it.
We'll check our wrappers for a hole to make sure that everything was sterile. And I can see some light through. There's a hole in this wrapper right here. So everything's contaminated from the whole case. Can you see it?
Okay.
So since this case was contaminated by the hole in the wrapper, an incident report should be filed, and the discussion needs to be had with the physician regarding contaminated instruments being used, and do we need to possibly put her on some prophylactic antibiotics.
Okay, so when opening the instruments, the sterile instruments with the Medline tray, we want to check to make sure that it was ran through the sterilization process with the red, you show the red indicator here, and also on this side it has red. Both of those are intact, then you're okay. Also, this line here should be black, and that also confirms the sterilization process. And here's one too. Okay. Okay, so then to open the pan, you just flip.
It's kind of hard because they're new.
Wow, I don't even know how I can do this. Kylie? Can't do
And
it.
trade me?
Yeah.
I wonder if it's up too high. You know, it's kind of hard. Yeah, they're hard.
Oh my gosh.
And I have purple tunnel. That's probably not.
This might not be good.
Yeah, we might have
You want to
to.
toss
You have
that?
to push the red in.
What's the
Just
which
the
pull
red
out?
button.
Now?
Yep, so
Okay.
we push the red buttons in, up, and then we pull this, pull that, aseptically off. I look and see, the indicators have changed completely, they're fine, and now that's sterile.
The inside of the pan.
Yeah.
I'm not gonna know.
So these are the class 5 integrators that ensure that this set has gone through the sterilization process. You'll see that it needs to go all the way to the accept. That black line needs to go all the way to the accept.
She is a primary C-section from peritoneal heart tones. She is no beta blockers, no anticoagulants. Her prep is dry. The non-sterile person will come over and tie the gown. If they want to spin, grab the card away from their hand and pull.
Come over to the sterile instruments. The inside of the pan is sterile. So you look straight out, set it down, bring this over to your patient, and then they can just go ahead and start working right away. At the end of the case, since we don't have the wrapper on the Mayo stand with the instruments, we have the pan and everything is sealed, sterile container. We don't have to check that, and we know that it was safe for the patient and everything was sterile.